Hello, everyone. My name is Savannah. I'm one of the dietitians here with RPM Logix. Thank you so much for coming. I appreciate you being here today. This is part of a benefit to your insurance, this RPM Logix program. So again, thank you for being here today. Today we're going to talk about diabetes and exercise. So this information will be applicable to all sorts of different people, even if you don't have diabetes. It's important to know like what normal blood sugar levels are, how to know what safe blood sugars are whenever you're exercising. And it's important to know what kind of exercises we should be doing every day as well. So we're going to get into that today. And after the presentation is done, I will take questions. You can, in the chat screen, ask questions throughout the program, throughout the seminar today. And at the end of the seminar, I will be answering any questions that you guys have. Okay, so give me one moment. I'm going to share my screen with y'all and we'll get started here in just a minute. Okay. So this is diabetes and exercise. Why are we talking about diabetes and exercise in the first place? Exercise is really important for a lot of different reasons. It's beneficial for several different things, and we'll go into some of those here on this list. First, it improves our blood sugar levels. So exercise, whether or not you have diabetes, does help your blood sugar levels. It boosts your overall health and your fitness. It helps you manage your weight. So whether you have a weight loss goal, a weight maintenance goal, or if you want to gain some muscle, these are all great things that exercise can help us achieve. It also helps lower our risk of cardiovascular disease and stroke. And finally, it improves our overall well-being. All right, so some people with diabetes need to track their blood sugar before, during, and after physical activity. This is especially important for those that experience hypoglycemia. And we will go into what hypoglycemia is here in a moment. If you manage type 2 diabetes without medication, you likely will not need to check your blood sugar before exercise. If you take insulin or other medications that cause low blood sugar, test your blood sugar 15 to 30 minutes before exercising. All right, so I said we would talk about what hypoglycemia is. Hypoglycemia is also known as low blood sugar, and this is a condition where your blood sugar levels drop below normal. This is usually 70 milligrams per deciliter or below, but some people feel hypoglycemia at levels above 70 milligrams per deciliter. I have some patients tell me that they start to feel kind of weak, queasy, shaky around 80 or 90 even sometimes. So if that's low for you, then that's low for you. But for most people, it's going to be 70 milligrams or deciliter, 70 milligrams per deciliter or below, qualifying for low blood sugar. Now, how do you know if you have low blood sugar? What are signs of hypoglycemia? They include shakiness, dizziness or lightheadedness, sweating, hunger, impaired vision, tingling or numbness in the lips, tongues or cheeks, headaches, and seizures. So be on the lookout, if you feel like you are prone to hypoglycemia, pay attention, see if you feel any of these symptoms, as this could be a warning sign that you are having low blood sugar. All right, so we talked about what low blood sugar ranges are. Low blood sugar is less than 70 milligrams per deciliter. But what are normal blood sugar ranges? So, a fasting blood glucose or a blood sugar where you have not eaten anything, you want to be between 70 and 100 milligrams per deciliter. After you eat or postprandial, you want to be below 140 milligrams per deciliter. If you have diabetes, you want less than 180 milligrams per deciliter after you eat a meal. All right, what are some target blood sugar levels for those with diabetes? So before meals, those with diabetes ideally want to aim for blood sugars of 80 to 130 milligrams per deciliter before meals. And then 1 to 2 hours post meal, like we said, we want it to be less than 180 milligrams per deciliter. So it is always best to check with your doctor about what activities might affect your blood sugar, when the best time of day is to exercise, how diabetes medications might affect your blood sugar as well as you become more active. Okay, so this applies to everybody. This is the recommended minimum exercise recommendations for everyone, whether or not that you have diabetes. And the recommended minimum is 150 minutes per week. If you break that up, that looks like 30 minutes a day for 5 days a week. The exercise should be moderate to vigorous in intensity. Here I've included some examples of exercises, of some cardio exercises that you can do. So we're going to talk about cardio and strength training today. As part of any of workout or exercise regimen, we want to include both cardio and strength training. So examples of cardio are fast walking or hiking, lap swimming or water aerobics, biking, stair climbing, dancing, group sports, exercise classes, and also chair workouts, cardio chair workouts. Here I've included some free cardio workout videos. So if you're interested in this video, or I'm sorry, in this presentation, at the end of this video, you can have access to these free cardio videos. I've also included on this slide free cardio videos for those who have limited mobility. So that looks like chair exercise videos that are cardio based. On this slide, I know it's a little bit hard to see. I'm going to try to zoom in. Oops, give me one moment. Okay. Unfortunately, I'm unable to zoom in on this slide, but I'll describe some of what this is. These are some seated chair workout ideas for those that have limited mobility, injuries, etc., anything like that. So there's lots of different workouts that we can do while we're sitting in a chair. Just some examples that are on this slide are a seated chest press. So that's where you're sitting here. You take some weights and you push the weights out in front of your chest, just like that. You can do seated bicep curls. So you can take weights and curl them up in this motion. You can do a seated shoulder press where you take weights and you lift them upwards. Other things you can do are knee to chest. So sitting in your chair and raising your knees up to your chest, just like this. You could do extended leg raises where you sit in your chair and you raise your leg up in front of you. You can also do these things called tummy twists or like abdominal twists, which are good for your abs. So you sit here and you kind of do crunches on either side. Okay. You can also do modified squats. So you can use the chair that you're sitting in to kind of help you sit up and down as you're doing squats in the chair. So these are just a couple of different ideas of chair exercises that you can do. Here are some cardio moves for limited mobility. So you can see these a little bit better, demonstrated a little bit better. Here, there's an alternating front punch. So you're just sitting in front of, sitting there and punching right in front of you. You can do a seated march where you're sitting and you're raising your knees up. Or these seated heel jacks that are shown towards the bottom. It's basically like a jumping jack, but you're moving one leg down at a time. And then there's another cardio move, this alternating tap and overhead reach. So tap your foot and then reach over like that. All right. Strength training should be completed about 3 times per week. Let's see. Strength training should be completed about 3 times per week. Strength training can include lifting weights, using your own body weight in training, or something called calisthenics. Calisthenics examples are doing push-ups or sit-ups or squats or lunges. So exercises that use your own body that you're not having to lift weights for, that's what calisthenics is. And that is an example of strength training as well. So you don't have to necessarily lift weights to strength train. You can engage in calisthenics, or you can use bands to take the place of weights as well. So these are different ways to get strength training in. Children and teens should aim to get at least 60 minutes of moderate to vigorous aerobic activity each day. Strength training should also be completed at least 3 days a week. Here, I've included free strength training workout videos. So if you can feel free after the presentation, if you're wanting access to this, I can email this to you per your request. If you just want to send your email in the chat box, if you're interested, I can send this over to you after the presentation. So these are free strength training workout videos that you can access. And on this next page, I've also included free strength training workout videos for limited mobility or for seniors as well. So some more of those chair workouts. And here's some examples of some strength workouts that are good for limited mobility or for seniors. As you can see in the top left, she's doing a squat with a chair. So feel free to use a chair to kind of help balance you as you sit up and down to do your squats. Top right, you can see he's doing a standing leg curl. So he's standing there and then curling his leg back up to flex his calf muscle. Here on the middle row, you see this lady doing a knee extension, leg extension, like we were talking about earlier. This lady here is doing bicep curls. So again, weights are a great example. If you don't need the chair, you don't have to use it. You can also stand, do whatever is within your own comfortability. You can do overhead presses, as this lady is modeling, or seated rows. A seated row is where you are sitting and you kind of pull in like that. So these are other additional strength training moves that you can practice at home. All right, so what levels of exercise, where should our blood sugar be when we're exercising? So let's go into that next. If we are lower than 90 milligrams per deciliter, our blood sugar might be too low to exercise safely. So before you work out, have a small snack that is 15 to 30 grams of carbohydrates. And in this chart, I've included examples of 15-gram carbohydrate snacks. Some of the healthier ones on this list are a small apple, half a banana, half a mango, a cup of watermelon, a medium orange, 12 fresh cherries, 15 strawberries, a small bunch of grapes, a slice of whole grain toast, or 8-ounce milk. There's also other ideas on here if you don't have access to those or do not like any of those. 4 ounces of yogurt is also another really good 15-gram carbohydrate snack. All right, if your blood sugar is between 90 to 124 milligrams per deciliter, take about 10 grams of glucose before you exercise. Here I've listed some snacks that have about 10 grams of glucose or carbs in them. Some of the healthier examples are going to be like a piece of whole grain bread. Let's see. An apple, a whole banana, a clementine, a pear, prune, plum, mango, watermelon. All right, so those are some ideas for you. Also, popcorn is a good example too of a 10-gram carbohydrate snack. So about 20 grams of that. If your blood sugar is between 126 to 180 milligrams per deciliter, you are ready to exercise. But be aware that your blood sugar might rise during strength training or high intensity interval training. That's what HIIT stands for. High intensity interval training is where you kind of do an exercise. You begin slowly, say for 2 minutes on the treadmill, going kind of slow. And then after that, you'll increase your speed for about 4 minutes or so. And then you'll go back down 2 minutes to a slow speed. And then for 4 minutes again after that, you'll be at a higher speed over and over again until the end. So it's kind of intervaling you through different intensity levels throughout a workout. So just be aware that blood sugar might rise during strength training or high intensity interval training. And we're going to talk more about that later and how it makes it rise and what to do about that as well. If your blood sugar is 182 to 270 milligrams per deciliter, it is still okay to exercise. Be aware that your blood sugar might rise during strength or high intensity interval training exercises. If you are over 270 milligrams per deciliter, this is a caution zone. Before working out, test your urine for ketones. The body makes ketones when it breaks down fat for energy. The presence of ketones suggests that your body does not have enough insulin to control blood sugar. So again, if you're over 270 milligrams per deciliter, check your urine for ketones. If you exercise when you have a high level of ketones, you risk a dangerous condition called ketoacidosis. All right, what is ketoacidosis? It is a serious and potentially life-threatening complication of diabetes that occurs when the body does not have enough insulin to allow blood sugar to enter the cells for energy. Instead, the liver breaks down fats to create fuel, which produces acids called ketones. When these build up too quickly, they can be dangerous in the body. So, what are some of the side effects of ketoacidosis? It can be quick or difficult breathing, flushed cheeks, abdominal pain, breath that smells like sweet acetone or nail polish remover, vomiting, dehydration, feeling very thirsty, urinating a lot, muscle cramps, drowsiness, or coma. So as you can see, ketoacidosis is a serious condition, and we really want to make sure that we monitor our blood sugar levels. What causes ketoacidosis? So infections such as UTIs or pneumonia, new onset diabetes, lack of compliance with treatment, being sick or stressed, which produces stress hormones that interfere with insulin, missing one or more insulin doses, insulin pump issues, or using expired or spoiled insulin. All right, so during exercise, make sure to watch for symptoms of low blood sugar. During exercise, sometimes low blood sugar is a concern. This is mostly a concern for those on insulin or other medications linked to low blood sugar. If you are planning a long workout, check blood sugar every 30 minutes. This is important if you're trying a new activity or increasing the intensity of a workout. The reason why this is important is because we don't yet know how your body or how your blood sugar will react to the new activity or the more intense activity, which is why it is recommended that we check our blood sugar every 30 minutes when trying out a new or more difficult activity. Stop exercising if your blood sugar is 70 milligrams per deciliter or lower, or if you feel shaky, weak, dizzy, or confused. Nausea is another symptom of low blood sugar. So what do you do if you have low blood sugar? Follow something called the 15-15 rule. The 15-15 rule says if you have low blood sugar, eat or drink something with 15 grams of fast-acting carbohydrate to raise your blood sugar level. We spoke about earlier, what examples of 15-gram carbohydrates are. If you're in a dangerous level of less than 70 milligrams, you might need something faster acting. For instance, fruit juice or glucose tablets. Once you're out of the danger zone, out of 70 milligrams per deciliter, and you test your blood sugar again 15 minutes later after giving yourself a 15-gram carbohydrate snack. If you're at least 70 milligrams per deciliter, and if you want to continue to raise your blood sugar more because that's still pretty low, you can repeat the process by adding in another 15-gram carbohydrate snack. If you're not super low, you don't really need a fast-acting one. You can use something like a piece of whole grain toast or an apple or a banana or an orange or any of those 15-gram carbohydrate snacks that we talked about before. But the point is, you want to continue doing this process of checking your blood sugar. If it's low, eat 15 grams, then check your blood sugar 15 minutes later. So that's what the 15-15 rule is. All right, after exercise, check your blood sugar after exercise and again throughout the next few hours. Exercise pulls reserved sugar out of your muscles and your liver. As your body rebuilds these stores, it will take sugar from your blood. Exercise tips and tricks. So just know the longer the workout, the longer it will affect your blood sugar. Low blood sugar can occur 4 to 8 hours after exercise. So having a snack with slower acting carbs after your workout can prevent a drop in blood sugar. Examples of slower acting carbohydrates are fruit, bread, and trail mix. So how does exercise lower our blood sugar? It's because our insulin sensitivity is increased, and we're going to go into what insulin sensitivity is. But because our insulin sensitivity is increased, our muscle cells are better able to use any available insulin to take up glucose during and after activity. What is insulin sensitivity? Insulin sensitivity is a measure of how responsive the body is to insulin. Insulin is a hormone that regulates blood sugar levels. Low insulin resistance or increased insulin sensitivity is generally better for your health rather than high insulin resistance. So ideally, we want low insulin resistance or increased insulin sensitivity. And you can get that by doing several things in your lifestyle, such as by incorporating exercise into your life, such as by choosing whole grains and limiting your carbohydrates to about a quarter of your plate. All right, insulin resistance. So insulin resistance, which is when we have, not good insulin sensitivity, can lead to elevated blood sugar levels or hyperglycemia, which can then lead to prediabetes or type 2 diabetes. How does exercise lower our blood sugar? So when our muscles contract during activity, our cells are able to take up glucose and use it for energy, whether insulin is available or not. This and the method mentioned before are how exercise lowers blood sugar in the short term. When you are active on a regular basis, exercise can help to lower your A1C. How does exercise lower blood sugar? Know that most forms of aerobic or cardio exercise will lower your blood sugar. So cardio or aerobic lowers your blood sugar. But remember, we discussed earlier, high intensity interval training and strength training can increase your blood sugar. How does exercise rise or increase our blood sugar? We get adrenaline going whenever we're exercising, and adrenaline is a hormone in our body, and it can increase our blood sugar levels. Using our muscles helps burn glucose and improves the way insulin works, but you might see your blood sugar go up after exercise as well. Exercises that raise blood sugar, heavy weight lifting, competitive sports, high intensity interval training workouts. These all cause you to produce adrenaline, which is a stress hormone, which raises blood sugar levels by stimulating your liver to release glucose. How do we avoid our blood sugar from rising during workouts then? So choose moderate intensity workouts with light weights and high repetitions instead of like super intense, very quick, very high weights. Do instead light weights with more repetitions and a moderate intensity workout. You can also practice relaxation techniques such as paced breathing or meditation before and during the workout to minimize this adrenaline effect. Also consider moving your workout to later in the day, especially if you exercise in the morning. The dawn phenomenon, which is a natural rise in blood sugar, occurs between 4 to 8 a.m. and can result in higher levels during morning exercise. Also, you can talk with your doctor about adjusting rapid acting insulin or other short acting diabetes medications before workout sessions that usually lead to a blood sugar rise. Finally, avoid eating excessive amounts of carbohydrates before and during workouts to avoid too high a blood sugar. Okay, that was it. Thank you so much to everybody for joining. I'm gonna allow the microphones on, and if anybody has any questions, please let me know. I did see a question in here asking how can we access the presentation. If you would like for me to send you this presentation, please type your email into the chat box and I will send it to you that way. Does anybody have any questions about anything today?
Hi, I'm trying to place my email in the chat box, and I don't think it's working for me too well.
Oh, okay. Um, Let me see if I have your email. One moment. Is it dbrownsimpson@gmail.com?
Yes, it is. Thank you.
You're welcome. I'll get that sent to you.
Can you do the same for me, Brenda?
Yeah.
Roski?
Miss Brenda, yes. Let me see if I have your email. Give me one moment.
Because I just came in. I missed everything.
Oh, okay. No problem. At least I can send this to you. Is yours kroskyb67@gmail.com?
Yes.
All right. I'll send that to you as well.
Thank you.
You're welcome.
Send me the YouTube for the seniors. You have my email,
Yes.
bmacrae@yahoo.
Yes, Miss Barbara. I'll get that sent to you as well.
And then I have a question.
Sure.
You gave a lot about testing, but if you're not type 2 diabetes or diabetes, you really don't have to test, correct? Blood sugar.
Well, that's really up to you and your doctor, kind of depending on how kind of comfortable you are with your blood sugars. I mean, most type 1s do test their blood sugars too.
But if you are borderline and you're not taking any medication
Uh,
and you're controlling it basically with what you eat, then you really don't have to do the testing like you suggested, correct?
That's correct. That's correct. If you're managing without any medications that don't lower your blood sugar and you're just managing and you're borderline through you're managing through diet and exercise, you don't necessarily need to test your blood sugar, no.
Okay, because I generally get blood work through my primary care physician, and he's not really suggesting any medication. You just follow, what I eat pretty much. Actually carbohydrates especially.
Okay, gotcha. All right. Well, yeah, thank you. That was a really good question. Does anyone else have any other questions for me?
Now the weights in the YouTube, do they tell you the size of the weights you had that you use weights? Like I was particularly interested in the chair exercises. So
Sure.
what size of the weights do they tell you? 2 pounds, 1 pound?
So you can use whatever size weight you're able to lift. That's going to be up to you. So they'll be using probably different size weights because, they're used to working out and stuff. They might be lifting like 20-pound weights, 15-pound weights. So just make sure that you have a good weight that feels good to you. If that's 2 pounds, if that's 5 pounds, etc.
Right, thank you.
You're welcome. I'm not sure that they'll give you exact information about the weights to use. I think they might just leave that one up to y'all to see what you're comfortable with. Okay, but yeah, that information will be in the PowerPoint that I send to y'all. Does anyone else have any other questions for me?
So this was recorded and we can see the whole thing because I'm particularly interested in those foods you listed, like 10 milligrams of carbohydrates.
Right, that's going to be in the PowerPoint that I'll send to you also.
Okay.
Yeah, so it'll all be in there. All right. Anything else, anybody? Okay. Well, thank you, everyone, so much for joining. I'm going to get this email sent out to everybody that requested it today. And thank you so much for being here. And I hope that you guys have a great rest of your night.
Thank you.
Thank
Same
you
to
for
you.
really
Thank
great
you.
information.
Thank you.
Oh, thank you so much. All right. Bye.
Bye.
Bye-bye.